Today, I want to talk about something that is happening to many women in their 40s and 50s, and most of them don't realize it's connected to perimenopause or menopause. Frozen shoulder, hip pain, sudden stiffness in the morning, Achilles tightness, plantar fasciitis, knee pain without injury, tennis elbow that just won't go away, low back instability, decreased strength, pelvic floor weakness. These are not random. Estrogen is not just a reproductive hormone. It plays a critical role in collagen production, tendon health, joint lubrication, muscle repair, and inflammation control. When estrogen begins to decline, even in perimenopause, tissues become more prone to inflammation, stiffness, and micro-injury. That's why frozen shoulder is dramatically more common in women between 45 and 60. Frozen shoulder isn't just a tightness, it's inflammation and thickening of the joint capsule. It can appear suddenly, often without any trauma. Hip pain is another big one, especially lateral hip pain that feels like you can't lie on that side at night. Often that's gluteal tendon irritation or bursitis, and highly associated with midlife hormonal shifts. Women also report waking up feeling stiff, like I aged overnight, hands that ache in the morning, knees that feel unstable, loss of muscle tone despite exercise, weight redistribution around the abdomen, slower recovery after workouts, increased inflammation. This is not weakness, it is physiology. So, how do we approach this correctly? We start with tissue repair and circulation, and that's where M-Vital becomes a cornerstone. M-Vital is high-intensity laser therapy that improves circulation, reduces inflammation, and stimulates mitochondrial function in damaged tissue. In frozen shoulder, we use it to reduce joint inflammation and improve tissue healing. For hip pain and gluteal tendinopathy, it helps calm inflammation and restore tissue repair. For plantar fasciitis, Achilles pain, knee inflammation, it can improve blood flow to tissues that naturally have poor circulation. Menopausal tissue needs more support. M-Vital helps restore the body's ability to repair itself, but repair alone isn't always enough. Muscle loss accelerates during menopause. Women can lose up to 10% of muscle mass during the menopausal transition. Less muscle means less joint support, less metabolic efficiency, more instability, more visible skin laxity, more abdominal fat storage. That's where M-Sculpt Neo comes in. Neo strengthens muscle deeply and safely, including glutes, core, arms, and legs. Stronger glutes improve your hip stability. Stronger core improves back pain. Stronger quads support knees. This is not only cosmetic, this is structural support. Pelvic floor is another major issue. Many women experience leaking when coughing or exercising, decreased core strength, pelvic heaviness, and lower back instability. Emcella restores pelvic floor strength safely and non-invasively. That improves bladder control, posture, and core stability. Then there's the brain. Brain fog, irritability, poor sleep, anxiety, reduced stress tolerance. Hormonal shifts directly affect brain signaling. ExoMind supports the neural pathways responsible for emotional regulation, focus, and sleep. It helps stabilize the stress response that often becomes dysregulated in perimenopause. Hormone replacement therapy, when appropriate, restores physiologic hormone levels, which improves collagen support, joint comfort, brain clarity, and metabolic balance. Peptide therapy can support tissue repair, muscle preservation, and metabolic function. Menopause is not just about hot flashes. It is about frozen shoulder, hip pain, weight redistribution, muscle loss, pelvic floor weakness, brain fog, slower recovery, increased inflammation. When we treat menopause properly, we don't just manage symptoms. We restore function. We improve circulation. We rebuild muscle. We calm inflammation. We support the brain. We restore hormonal balance. This is why menopause care can be comprehensive, and this is why we've built systems that address all of it. You are not aging overnight. Your physiology has shifted, and it can be supported.